screen.
Okay, perfect.
Okay, perfect.
Okay. Thank you so much for that lovely introduction, and thank you so much for inviting me into this space. I really appreciate it. So I think most of you are familiar with TAASA as the statewide organization and coalition of rape crisis centers and other allied professionals and survivors. So the way that our legislative session, our membership creates our priorities. And the way that they do that is we hold stakeholder groups during the interim. And we'd love for some of y'all to be on those groups where we talk to folks from the field and we identify major areas of need. So things that are making it difficult for them to do their jobs correctly, or things that they would like to do for survivors that they're not able to do. And we make a big list of all of those problems in the state. And then we think about which ones can be addressed via legislative action, via funding, via statutory changes. And then we take that narrowed down list and we think through what we believe to be possible to do during a session. So for example, this year that meant that we couldn't seek anything that was going to be expensive because we knew ahead of time that the legislative session was going to be dealing with a pretty rough budget because of COVID. So we narrowed it down to exclusively non-funding priorities. And then we have our membership vote. And the 5 most important things are what we carry into the legislative session. So that means that those are the things that we pursue most aggressively because it's what our membership wants us to do. But things crop up all the time that we really like, so we go out and support them, or things that we are not sure are good for survivors. So we try to have conversations with the authors of those kinds of bills to make sure that our concerns are heard. Okay, so broadly speaking, this legislative session, because of COVID, there's not as many bills as there usually are, but there are still a lot. I think most of you are probably more familiar with what the DV Coalition, TCFV, is doing this session. But broadly speaking, we are working on funding initiatives. TCFV is also working on funding initiatives, including full funding for DVHRTs. Other priorities include a focus on survivor safety in conditions of bond, so that officers can verify and enforce conditions of bond by being able to see them in TCIC. And that's Senate Bill 343. And then TCFV's other priority is a statewide task force on firearm transfer policy implementation. But broadly speaking, in addition to the legislative priorities that I'm going to go over in a minute, we're seeing some really good sexual harassment legislation. So we are seeing some expansions to our sexual harassment law, both in terms of opening up and expanding the statute of limitations for reporting sexual harassment in the workplace to the Texas Workforce Commission or to federal agencies. And including small businesses with less than 15 employees in the in sexual harassment law, because currently if you're being sexually harassed at work and you work for a small employer, which is roughly half of Texans work for a business with less than 15 employees, there's functionally nothing that the state or federal agencies can do to protect you. So that's really exciting. We have some protective order bills that are good, that clarify some of the things that are confusing in protective orders, like questions around default orders and proof of service. And then more on the family violence side, there's some great bills around like coercive debt and ease of documentation, getting your documentation back. You know, your driver's license and those kinds of things, making it easy to get those documents back if you've left a family violence situation. We're also really excited to see some good bills around dating violence and prevention, specifically in schools. Okay, so this session, we knew pretty early on that the budget was going to be really tight. And it's actually not as bad as we thought, which is great news. And both TAASA and TCFE are in a pretty good place with the budget. We are not expecting cuts, and in some places we are expecting an increase of funding for centers, which is amazing news. It's not finalized yet. The Senate just finalized their version yesterday, and the House is working on theirs, and then they'll go to conference committee and make sure that those two versions agree with each other. There's been significantly limited public access to the building. I have to get COVID swabbed every time I go in. That's what this is for. I feel like I went to like a cool show or something, but really I just went to the Capitol this morning. And some of the committees are allowing virtual testimony, so they're allowing somebody to Zoom in and testify to protect their own health and safety. Other committees are not doing that, so it's really a case-by-case basis of who we can get in for virtual testimony and who has to come into the Capitol. So we are asking folks from the field to really focus on written testimony, which can be as powerful as coming in person, but is a safer option for folks, especially if you haven't had access to a vaccine yet. Okay, so these are our priorities. The first one is a big one. So we heard from the field last year that particularly community-based programs like Texas Forensic Nursing, Excellence in Houston, I think I got their full name right. I'm used to seeing it as an acronym, or Safe Alliance here in Austin has Eloise House, or Dallas has Courtney Safe Place, which are all community-based SANE clinics, so they're not in the hospitals themselves. We realized that they don't have access commonly through state funds for things like HIV prophylaxis, which can be very expensive to access. And that started a conversation around the codification of community-based clinics so that they are a national best practice, right? They provide incredibly trauma-informed care. There's no risk of a survivor getting a bill for treatment at one of these clinics, whereas they would run the risk of getting a bill if they went to a hospital. And while there are only a handful of these programs in the state, they are also, it seems like there's going to be a lot more soon because they're a more sustainable, more trauma-informed model for care. And they're providing roughly 25% of the exams in the state. So even if there's only a couple, they're doing a ton of the work around forensic examinations. So we wanted to get them codified into statute. So this piece, we ran it through the governor's task force on sexual assault so that the language is really fine-tuned. And it will be heard this afternoon in Homeland Security. So after we get off the call here, I'm going to run back to the Capitol, and hopefully that'll be a successful hearing. This second piece is, so for those of you who have been in the field for a while, you might remember a couple of legislative sessions ago, we wrote into statute that family violence advocates had absolute privilege. But when that statute was drafted, sexual assault advocates were excluded. And a lot of you can appreciate that sexual assault advocates and family violence advocates are often the same person, and they are being beholden to two different levels of privilege under the law. So this bill, which has been heard in both the House and the Senate now, it's in really good shape, should clarify that sexual assault advocates have absolute privilege the way that family violence advocates do, so that survivors can be offered absolute confidentiality protections when they're talking to a counselor at a crisis center. This third piece is trauma-informed investigations. It is making its way through the House right now. It should be on the floor any day. Donna Howard's office is carrying it for us. And this bill does three things to make the process of reporting a sexual assault exam more trauma-informed and less re-traumatizing for survivors. So the first thing that it does is it strikes law enforcement's ability to polygraph a survivor. That is not something that we believe is terribly widespread across the state, but we do know that it is happening occasionally. And not only is that against the letter and the spirit of VAWA, it's also a horrifying practice. So that's the first piece. The second is that law enforcement has the ability to decline access to a forensic exam if they believe that the survivor is not telling the truth and there's no evidence that they have been assaulted. But we all know on this call that the evidence is in the exam, and so law enforcement doesn't necessarily need to have that role and should not be gatekeeping exams for survivors. So we are going to ask that healthcare providers and not law enforcement make the determination of whether or not an exam is needed. So that's the second piece. And the third is that we would like advocates to have a legal presence in a law enforcement interview the way that they do during a forensic examination. So they're not allowed to impede the interview at all, but they are there to provide a hand to hold, somebody to process trauma with. And so if a survivor wants that, they should be allowed to have somebody in the room with them who is a trained advocate. This fourth piece, we are planning on strengthening community responses to sexual assault. This bill is being carried by Jane Nelson, who is a senator. So we know that less than 10% of rape victims in Texas ever report their assault to the police, in part because of all of the reasons I just mentioned about the last bill. But we know that multidisciplinary response teams and SARTs are a national best practice for communities to come together and create a plan for when somebody comes in, says they've been assaulted. We want all Texas communities to have that plan in place and to know who the other stakeholders are in the community who can support them. So it requires county stakeholders to come together. It's a quarterly meeting, much like the child teams. It's a lot of the same stakeholders. So it's just a quarterly meeting to create a plan, which is in and of itself, like it's a start, right? Okay, and then this is our last priority item that got folded into two different bills. We as TAASA do not spend a lot of time focusing on penalty enhancements for sexual assault. We feel like our penalties are, generally speaking, where they should be, particularly since so few rape cases end in a trial. We tend to focus on the prevention and crisis center side of things as opposed to the penal code. But occasionally we see significant loopholes in our penal code that we feel like need to be addressed, and these are two of them. The first is that we want to include professional deception as an illegal means to gain consent for sexual contact under the guise of medical or mental health care treatment. So this is in response to the Larry Nassar case, but also some cases that actually came out of Harris County over the last year or so. We've worked with a prosecutor and some law enforcement where either we had folks posing as doctors to give pelvic exams who were not in fact physicians, who were then only chargeable under a fraud statute as opposed to a sexual assault statute, and folks who were using the context of mental health care as, like calling sexual contact treatment in a mental health care setting, which is not a place where consent can exist. So that's the first piece. And then the second is that we need to clarify that people in the custody of law enforcement cannot give consent to sexual contact with law enforcement. And so that statute is currently under our official oppression statute, which is where all of the language is about how law enforcement needs to behave on the job, but it's not in our sexual assault statute. So we came under fire as a state last summer for not significantly addressing law enforcement sexual assault, because as we, and sorry, lost my train of thought, it's been a long day. So it elevates criminal sexual contact to a secondary felony, which is what all of the rape charges are. because previously it was a state jail felony, which is a common penalty for like property crimes and doesn't reflect the seriousness of this kind of assault. And that bill has been heard in both the House and the Senate. There is another version of it that's going to be heard in the House on Monday that we're planning on supporting. That goes back to what I was saying earlier about other bills coming up that we get really excited about, but weren't part of our initial plans. So we go out and support them. Okay, so I ran through that pretty quickly, but does anyone have any questions?
Yeah, well, I don't know if I have any questions, but I guess some of those things I've got fog brain. Well, the last one, I'll start with the last one about the loophole regarding law enforcement and someone who's been taken into custody.
Mhm.
I guess I'm kind of surprised by that. I'm feeling like I'm kind of out of the loop because I guess I thought that that was something that had already been addressed. So maybe you can give me a little bit more because when you started talking about that one, I was like, that doesn't make sense.
Yeah.
And I don't know if I'm the only one.
No, I mean, it did not make sense to me when I realized that we don't appropriately address this in Texas law. And interestingly, a sheriff out of, I think, Grayson County was the one who initially brought this bill to one of the lawmakers. Like, we were asking other lawmakers about it, and the sheriff brought it to somebody else and said, like, you know, we need to be held responsible for ourselves, and it's not okay that this is a lower offense. So yes, so Texas law does two things that I think are not ideal when describing this crime. One is that it's a state jail felony and not a second-degree felony. When like clergy sexual assault or doctor sexual assault or any of the other very clearly defined power dynamics in which consent cannot be given, those are all second-degree felonies. So we were charging it at a lower level of offense, which is what this bill seeks to correct. The other thing is that there seems to be some confusion about what the word custody means. So does it mean that you have been like detained formally? Does it mean that you've been arrested? Are you like wearing handcuffs in the back of a police car, or are you just like stopped on the side of the road? And I don't think that it should be up to the person who is having that experience to fully appreciate the nuance of what level of custody they're in. So the bill that is up on Monday includes some language around like detaining and opens up the definition of custody to cover all of those experiences as well.
Again,
Yeah.
Okay. I'm sorry. Yeah, that one kind of boggles my mind. Okay. All right. And again, maybe I'm the only one. Okay. Any other questions or comments?
Will it be possible to share the PowerPoint?
Yeah, Jessica, I can do one better. I have like a one pager with all of this on here. I can send that out to the group.
That'd be wonderful. Thank you so much.
Yeah, of course.
And we'll have the recording up on our website probably tonight or first thing in the morning as well. And we'll send out a link to everybody through the newsletter.
Any comments from those who are in maybe higher ed or who are in healthcare? I thought that was interesting also about the piece around having access to the prophylactics and things of that nature. Mm-hmm. So again, I don't know if people from higher ed or healthcare have any comments.
Yeah, I will say that I know last session there were a lot of bills around Title IX or creating a quote unquote Texas 9 because of what was happening at the federal level. We held off intentionally on doing a lot of stuff around campuses this session We are partnering with UTMB, who's running some really great data collection around all of those changes in Texas law happening at the same time as changes on the federal level, to sort of better understand on the ground what folks are doing, how implementation is working now that state and federal law have changed like 4 times in the last 2 years. So we didn't want to muddy the waters anymore by adding more changes to those, but we plan on doing a good job with, hopefully, I would like to think that we will, having some stakeholder groups from higher ed over the next year to really get a better understanding of that. And that combined with the data coming out of UTMB, I think that we will be in a place next session to make some much more educated and informed policy suggestions around that. So if you are interested in doing that work with us, please let me know.
That's good to know. And your contact information will be in there, because immediately I think about Allison Vogt at Rice University, and I know Dr. Kaufman of Lee College, that may be of interest to them.
Yeah, that would be lovely.
Awesome. And Dr. David as well. All right. Well, if there are no other questions or comments, again, I'm still just kind of boggling over the whole law enforcement piece. I'm sorry. That one just kind of like stumped me. Yeah. Yeah. So, all right. So everyone is okay. Everyone's good?
And thanks, Guadalupe, for the kind words. I'll make sure to tell Kristen I appreciate it.
All right. Well, Amy, any thing you want to share? Because if not, we will start bringing this meeting to an end.
Wow, that's great. Thank you, Catherine, so much. Thank you for the good information, and God bless you for working at the Capitol this go round. And we know you got to go back, so we appreciate you taking the time out to be with us. And it sounds like that y'all got this under control. So we're very thankful for you guys and TCFE being up there and representing us. So we really appreciate that. And thanks for the funding. Thanks for the funding update. Hopefully we'll keep getting funding. So so we appreciate that. So thank you so much. Yeah, so our next meeting is May the something.
11th, I believe.
May the 11th. Okay. Oh, it's May. No, it's May 13th. It's May 13th. Yeah, so May 13th. And so we will see you then. Tisha, do we know the topic?
Oh, the topic is going, and help me remember the person's last name. Her first name is April, and where the topic will be, she's with the Child Abuse Task Force, and she will be coming to give us information about some studies, I believe, that were done around child abuse. And just as a side note,
Angie Hayes.
Angie Hayes.
Yes. Okay. Yes. So the Harris County Child Abuse Task Force, it's their not task force, it's the Harris County Child Fatality Review Team. It's their 10-year decade report. So it's information on child deaths in Harris County for the last 10 years. It's very fascinating data, which is sad, but it's very fascinating. And I think a lot of people will be interested in it. It's out of the Child Fatality Review Team. So it's a really interesting report to look at. So that's great. So yeah, so her name is Angie Hayes. So she will be here on May